Welcome to Kindred.
Welcome to Kindred.
Welcome to Kindred.
Welcome to Kindred.
Welcome to Kindred. We're glad you're here.
Hi, I'm Ben Breyer, the President and Chief Executive Officer here at Kindred Healthcare, and welcome to Kindred. On behalf of all of us, you're now a part of a team with more than 100,000 teammates across the country. Kindred is a big, diverse healthcare company. In fact, we do business in almost every state across the country, more than 2,700 locations. Last year, we saw more than 1 million patients. We have here at Kindred some specific mission, culture, and values that we care so deeply about. And as new employees, I want to tell you a little bit about it. Our more than 100,000 employees, for the most part, about 85% of our company, are caregivers across the country. And so because of that, our mission is to value people, is to provide hope, is to provide healing and recovery to all of those who need it. We really have a philosophy here that if we do the right things for our patients, and if we do the right things for our employees, our business and our financial performance are going to follow in sort. Let me tell you a little bit about our business mix, if you will, in terms of the company that you've now joined. As one of the largest and most diverse healthcare provider companies in the country, we really have 4 different businesses that we're in. So let's start with our hospital division, which we call transitional care hospitals. And I think that one of the things that I'm so proud of are the miracles, literally, that we perform every day and the kind of care that we give.
When he first arrived, he was on the ventilator. He had a tracheostomy tube. He was essentially in a coma. He had a really severe head injury. He had been in a motorcycle accident.
The amazing thing about Kindred Hospital was everybody took a personal concern with Andrew.
It was just a really wonderful outcome. All the different disciplines worked together.
I can't tell you how happy I am that our son is, even this day, recovering.
I definitely want to say thank you, and that I wish everybody the best, and I hope that God touches all their life, how they all touched my life and helped me so much.
All those people that were there today, they became our family because they knew him and they knew what he needed.
Thank you for letting us be a part of his care, because it's so nice to see like what you do is actually making a difference.
I'm Pete Calmy, President of Kindred's Hospital Division. Our transitional care hospitals across the nation are certified by Medicare as long-term acute care hospitals, also known as LTACs. In our LTACs, we care for the most difficult to treat, chronically, critically ill, and medically complex patients. These patients generally require specialized and aggressive interventions over an extended recovery period and benefit from our interdisciplinary team approach. From all of your hospital division team members, welcome to Kindred.
Shifting over to our Kindred at Home segment, making sure that the elderly population here in the United States is cared for at home in a really meaningful way.
I'm Ralph Keeling. This is my wife, Sammy. We've been married 72 years. And when one of us is not around, it's pretty doggone lonesome for the other one.
That's why we're here, is to get them at a level of independence so they can remain at home.
How you doing today, Ralphie?
Oh, they kicking very high. Paul has helped me lots and lots and lots.
He was really here for both of us at the same time.
Good. Keep those steps long, Sammy.
He was the best. If it hadn't been for him, we'd probably been in a nursing home. I just appreciate Paul so very, very, very much. If it hadn't been for them, I couldn't have been here.
He helps keep us together. He helps keep us moving.
If I can make a difference, I've done my job.
Hello, my name is David Cosby, and I'm the president of Kindred at Home. Kindred at Home is the nation's largest home health, hospice, and community care provider in America. At Kindred at Home, we provide a variety of services that include custodial services, restorative services, palliative care services, and end-of-life care to over 130,000 patients and families each and every day. We pride ourselves on clinical excellence and great customer satisfaction. On behalf of the entire Kindred at Home division, I'd like to welcome you to our team.
We also now are still the largest rehabilitation provider in the country in our third division, Kindred Rehab Services. We run not only large inpatient rehab facilities, but we run acute rehab units inside of community hospitals. And we also have, over on the rehab care side, the largest skilled nursing contract rehab service company in the country. Again, providing rehabilitation needs for all those who need it everywhere across the country.
He was shaking. It looked like he was having a seizure. So we called 911 and they came and took him to the hospital and they rushed him down to get a CAT scan, and he had suffered what others would call a traumatic brain injury. He had lost the ability to talk, walk. He had a feeding tube. He couldn't sit up on his own. He couldn't even hold his head up. He didn't make eye contact. He was completely like a vegetable.
Looking at Kyle, he was young and otherwise healthy. I think none of us felt like we could live with not giving him the chance.
It was really just being patient and letting his body do what it could do.
Walking with a walker, walking 20 feet, stopping, taking a break, to walking 50 feet, to walking, holding a therapist, to finally walking on my own, walking like a full lap around the facility. That was a monumental day.
I think he's the product of a lot of hard work, a lot of good communication, good teamwork, and people that were really dedicated to getting him better.
Words can't express the thanks I have. I mean, it's so cliche, but you can do anything if you put your mind to it.
I'm Jason Zachariah, President of Kindred Rehabilitation Services, the largest provider of diversified therapy services in the country. Through Kindred Hospital Rehabilitation Services and Rehab Care, we treat more than 500,000 patients a year across the full rehab continuum. Through contract therapy, jointly owned inpatient rehabilitation facilities, and as the rehab provider for Kindred facilities. For more than 30 years, our partners have relied on our promise of delivering the best possible outcomes. We're happy to have you join the Kindred family.
And our fourth division is our nursing and rehabilitation division. We have skilled nursing and subacute facilities all over the country. We're still one of the largest providers of care in this setting, and we still think that the skilled nursing setting is one of the most important parts of care for the kinds of patients that we treat in this post-acute delivery system.
I had a second amputation below the knee, amputation due to diabetic, and later I found out vascular problems. And I said, well, I want to go to the best place possible.
He needed some extensive treatment, some antibiotics and physical therapy, OT, to be able to function at home.
And we just worked really hard for an hour or so, and the whole time singing, laughing, making jokes, and trying to distract ourselves a little bit from some of the pain and sweat and tears that are going into what he's doing.
It came to the point where Lawton is now my Lawton family.
The time that I took care of him, he made me feel very proud to be a nurse.
And he had really gained a sense of independence and mobility by the time he left here.
They made such an impact on my life. They're amazing people.
Hello, my name is Mike Beal. I'm the president of the Nursing Center Division. Our nursing and rehab centers provide clinical and rehab services in a cost-effective setting to support the recovery and safe transition home. We have centers across the country that provide such options as assisted living, long-term care, short-term rehabilitation services. Our goal in the Nursing Center Division is to meet the patient where they are in their recovery and to provide the right care at the right time and the right place.
Hello, I'm Kent Wallace, Chief Operating Officer for Kindred Healthcare. I want to welcome you to Kindred and want to spend a few minutes today with you talking about the incredible honor that we have in serving our patients. Our population, the silver wave, is increasing rapidly. The number of people aged 85 and older is expected to triple by 2050. People are concerned about the cost of care. Currently, we're in a fee-for-service model, but soon to be in a fee-for-value model, where we may be paid a lump sum of money to take care of an individual over a period of time. I'd like to talk to you about integrated care networks. We're fortunate with Kindred is that we have the only post-acute care chassis which has what I would consider the 4 key components for an integrated care post-acute delivery system. And what I mean by that is we've got our long-term acute care hospitals to take care of the very sick patients. We can move them down the continuum to a skilled nursing facility in our nursing division, or if they need to go to a rehab IRF hospital or have rehab services in some other setting. And then finally, to the home care and hospice care. And I think that's really our mission, is how do we get people from the acute care hospital to home? We've got the perfect setup. There's no one else that can do it but Kindred. If you haven't been challenged yet with aging parents or relatives, you're going to be. Over the last year, I've had to deal with my mother-in-law and my father, and I really didn't, even being a healthcare professional and being in my role, there were times where I had questions. And Kindred, again, with its unique platform, has created a Continue the Care 1-866-KINDRED. And you can call and speak to a registered nurse and get advice about what's right for your family.
So the contact center started in 2014, and we started with about 500 calls a month. Now we're up to about 5,500 calls a month. The lack of resources as our consumers are trying to find, what do we do next? What's after a hospital? What's after a nursing home stay? Being able to answer those questions by staffing us with registered nurses 24/7 and adding in the Continue the Care and adding in aftercare, we're not only able to help the patients and their families, but Kindred as a whole.
Thank you for calling. My name's Lee and I'm a registered nurse advocate. How can I help you today?
Anyone can call anytime, day or night, and speak with a registered nurse.
I think that whenever you have a registered nurse answer the phone, for a patient, there's some kind of security there, that feeling that the person on the other end actually knows what you need and can really help you and guide you in the right direction.
We are able to help a consumer who is lost. We hear the desperation in their voice when they call. So we find out what their need is. We have the ability to make a huge positive difference.
Hi Melanie, this is Julie with Kindred's Continue the Care team. I just wanted to let you know that Mrs. Dotson has been accepted.
We started Continue the Care in order to really educate our patients on the availability of the Kindred Continuum, all of the different lines of service we offer across the country, and really what's out there for them, and that we're able to keep that continuity of care. The goal of Continue the Care is really to get the patient to the right setting at the right time with their prior level of functioning.
Hi, this is Emily. I'm an aftercare nurse with Kindred Healthcare. I was just calling to check on Mr. Fulker.
It is a program made up of specialty trained RNs. We perform discharge follow-up calls to our patients that have received Kindred services. We do so in very specific intervals based on what line of business they were a part of.
Which not only is great for the patient because it prevents them from going back to the hospital, but it's also great for Kindred.
It sounds like you would definitely benefit from some more physical therapy and probably even a nurse.
The biggest reward is knowing that you're actually helping people and you're helping families and that you get to make them whole again.
We're here to address their needs. They feel better, they feel safer, knowing that they have us as a resource.
Oh, that is so good to hear. I am thrilled. Oh, you are so welcome. It's been a joy.
Hello, I'm Steve Keenanen. I am Kindred's Chief Administrative and Chief People Officer. I welcome you to Kindred. And I'd like to talk to you a little bit about some of the functions that we do here within People Services. The first is talent acquisition. Talent acquisition is what you just experienced. It's how we move talent through the organization and how we acquire talent. The second big function that we have is talent management. And that's how we continue to grow and develop employees once they're here. There's a variety of programs and processes that sit within talent management that you'll be experiencing very soon. The third is total rewards, and total rewards contains our compensation and benefits function. The fourth is employee engagement. Within employee engagement, we have our diversity and inclusion work. We also have our engagement survey, which is a yearly process that we do here at Kindred. The last part of the People Services organization I'd like to talk a little bit about is core people services. There we have our mergers and acquisitions support work that we do. We also have onboarding and employee lifecycle management. And it also includes labor relations. I wish you a long and productive career here at Kindred. I hope that you continue to be challenged. I hope that you continue to grow. And I hope you continue to develop your career with us.
So as you can tell, we have a wonderful and diverse company here at Kindred all across the country. And on behalf of myself, and as I mentioned earlier, the now more than 100,000 teammates that you have by your side, we welcome you to Kindred. We're glad to have you as a part of our family, and we hope and look forward to you having a long and successful career here at Kindred into the future. Thank you.
Welcome to Kindred.
Welcome to Kindred. Welcome to Kindred. We're glad you're here.